Good morning, class. I am going to be performing hand and fingernail care today. I'm going to demonstrate it to the CNA students how to perform hand and fingernail care. So, as always, these videos are meant to help nursing students, CNA, LPNs, RN, home health aides, to deepen their understanding and help them to prepare for the Prometric State Board exam. So today, as always, if you like these types of video, please consider subscribing to my YouTube channel. Please like and share and drop your comments below. And smash that subscribe button. I would really appreciate it because it helps the YouTube algorithm to show my videos to more students so I can help students. My goal as a nurse is to help students to pass the CNA exam or their LPNs or their RN exam and help them to positively contribute to society. Get a job, able to work, able to help patients and contribute to society in a positive way. So, my equipment for this scale is soap, hand lotion, several washcloths, gloves, drying towel, orange stick, and a filing blade. I have my basin with water. So first I need to knock.
Come in.
My patient said I could come in, so she gave me permission to come in. Good morning, how are you?
Good.
My name is Miss Henderson. I'm going to be your CNA today, and today I'm here to perform hand and fingernail care. Is that okay with you?
Okay.
Okay, I'm gonna go wash my hands, gather my equipment, and be right back. You wash your hand 15 to 20 seconds. You come back, you gather all your equipment. When you come back to your patient, you have to ID. Hi. Oh, your name is Mina. Hi, Miss Mina. How are you?
Good.
Miss Mina, what is your date of birth?
1964.
Okay, so I did my two identifiers, date of birth and her ID. So I confirmed that I have the correct patient. My patient is sitting upright. If you want, you can pull the privacy curtain to maintain her privacy and dignity. That's also important. So I have my water here, and I've checked the temperature. The water is pretty warm and nice for me. But what about my patient? I'm going to ask her, Mina, can you check the temperature? Is it okay for you? Is it fine?
Yes.
It's not too hot, right? Okay, can you place your hands in there? Let it soak for 10 to 15 minutes. Her hands have to soak for 10 to 15 minutes. Guys, I'm going to put gloves on for this skill because remember we have to use the universal precautions, right?
Yeah.
We have to protect ourselves and we have to protect our patient also. So we must use universal precautions when we are dealing with any type of patients. So how is it going, Miss Mina?
Good.
It's going good? How does it feel in the warm water?
Relaxing.
It feels relaxing?
Yeah.
Make sure you clean all surfaces of her hands, nice, and the palm of the hands. Okay, so now we're gonna have to have a drying towels. Place your hands on this. So now we have washed our hands and our hands are nice and clean. So now we have to what?
Dry.
We have to dry it. Okay. So, Miss Mina, I have here a orange stick. This helps to remove any type of particles from under your nail. So I'm just gonna place it under here and try to remove any type of particles. Is that okay?
Okay.
Is it hurt?
No.
Your nails are nice and pink, very clean.
Thank you.
You're welcome. Nice and clean, very pink. Okay, so I have how would you like your nails to be filed? Round or square?
Square. Round.
You like it round?
Yes.
Okay, good. You get your nails done every time. Keep them nice and healthy, right? So, Miss Mina, do you have a favorite lotion you like to use on your hand?
Yeah.
What type of your favorite lotion you like?
Avino?
Oh, you like Aveeno? Okay. So I'm gonna put some Aveeno. You want me to put some Aveeno? So now I'm getting ready to put some lotion on the patient's hand, and I give her choices. What does she like? Does she like Aveeno? She likes cocoa butter. She likes regular lotion. What does she like? So I'm gonna take my gloves off because when I'm putting the lotion, it gets messy, right?
Yeah.
So, and then you have to make sure that you kind of gotta warm it up a little bit, right? Place the lotion in your hand. You kind of, in a circular motion, try to warm it up to proper body temperature. Okay, so now I'm just going to rub her hands. Kind of a little massage, right?
So good.
It feels good?
Yeah.
You like it? I'm glad you like it. So now her hands are nice and clean. So we did the lotion. So now we are going to dry off the excess lotion. We don't want, excess lotion on her hands. We dry it out. So Miss Mina, that was it. I did the hand and fingernail care. How does it feel?
Good.
Okay.
Nice and clean.
Nice and clean. Okay, good. So next thing I do, I remove this. I put it into the dirty hamper. As always, you have to put everything in the dirty hamper. The washcloths. Make sure you dispose of the water. Wash the basin. Take paper towels and dry it and place it in its designated area. So we have that. Then you go to the sink, you wash your hands 15 to 20 seconds, and then you come back to your patient. Miss Mina, here is your call bell. Do you like a magazine to read? Would you like to look at TV?
No, thank you.
Okay, so you just want to sit and by yourself. You don't want to watch TV. All right, so here is your call bell. If you need any help with anything, please feel free to call me. You tell the evaluator, my skill is now completed. Do not say your skill is completed if you know you're missing something. After you reassess everything, then you say your skill is completed. So guys, that's it for this video. I hope this video was informative and it provides you with some educational material to pass your CNA exam. Thank you so much for watching, and please subscribe to my YouTube channel and drop your comments below. Bye for now. I'll catch you in the other one.